basics of tinnitus, why tinnitus occurs, the technology, the impact of management, tinnitus management. Again, those management strategies. I always tell patients this is not there's no magic pill out there to eliminate, but how can we manage it to make it better for you? And basically what to expect during a tinnitus treatment evaluation. So let's start off with the basics. What exactly is tinnitus, right? So we define it right as a ringing or similar sensation in the ear. It could be ringing, buzzing, hissing. Certainly could be music as well. We actually have patients that have a piece of music that plays in their head on repeat. It's actually called musical hallucinations, even though the word hallucinations, I wish they wouldn't say that, but it is a type of tinnitus. It's not certainly more of a rare tinnitus, but the majority that we see is more of a ringing, buzzing, and hissing sound. Can be one ear, both ears. It could be centralized. I call it midline in the head. And there's lots of causes, which we're going to go over some today. Again, there's no cure for tinnitus, but how can we manage it better to make you have a better quality of life? So a couple facts about tinnitus. Can you believe 50 million Americans experience tinnitus? I know I do. And we're going to get certainly a testimonial later this hour regarding that. 15 to 20% of the general population is affected by the ringing, buzzing, hissing, but only 16 million people seek medical attention. 2 million are seriously disabled by tinnitus. And 90% of tinnitus cases present with some hearing loss. So again, you don't have to necessarily have hearing loss to have tinnitus. So just some causes, right? So tinnitus is a symptom typically of an underlying condition. It's due to, physiologically, it's due to the sensory neural reaction to the damage of the ear and the auditory system. So most patients experience a noise exposure event, whether it's one type of event like an explosion or a noise event. Maybe they had a noisy job or a noisy hobby. Or they're, certainly gun shooting, farming equipment, bands, concerts, things like that can absolutely impact not only your hearing, but also can add ringing to the ears, buzzing, tinnitus, right? Several types of medications, large doses of aspirin can cause tinnitus, cancer medications, and some antibiotics. There's a great website, and I have it listed at the bottom, the ATA.org. There is actually a list that they have on their website that lists 200 medications that can cause tinnitus. However, when you're off that medication, if you can go off of it, typically that tinnitus will subside. TMJ, temporomandibular joint, right? So right here, the clicking, grinding of your teeth, that can absolutely cause tinnitus as well. Traumatic brain injury, and simple things like earwax or other blockages of the ear canal. That's why it's so important to seek medical attention, just to rule out any of these, in terms of, something like that, earwax, right? Sinus pressure, barotrauma, quick changes in pressure, scuba diving, things like that can absolutely, concussive blasts that, we've seen in other countries, with our delegates, over in China. I know they had, I think it was Cuba as well, had some concussive blasts, and they actually had some ringing in the ear. Again, ATA.org is a fantastic, and you can actually be a member of it. It's a great resource for you as well. So just part one, just wanted to touch, there's so many types of management strategies out there. We are going to touch a little bit on some of them today. We're going to really work on sound therapy, which is a real popular one that James will get into a little bit, music therapy, things like that. So the relaxation is certainly key to many of these strategies that you'll see here. Again, there's no magic pill. Like I've seen the commercials too, ring stop. My kids get me, from the television, Mom, there's a tinnitus commercial again. So this stuff, it really does not work. Ginkgo biloba, I remember that from 20 years ago. Unfortunately, lipoflavonoids, there is no medical documentation behind it that says, yes, these are something that cures tinnitus. I wish there would be, but there is not. I mean, certainly there could be a placebo effect to some of these that, can maybe that would help, but the majority that we know of, those particular pills do not work. Physical activity. I think that's really good for you in general, keeping in general good health, avoiding a healthy diet, avoiding salt, all the fun things, right? Avoiding salt, caffeine, alcohol, excessive alcohol, and smoking. Interestingly, hypnotherapy. Again, it's going to assist with relaxation, reducing anxiety. All right. CBD, although it is not regulated by the FDA, patients have attempted, CBD. I've seen patients work with CBD. We don't offer it in the office, but they certainly, there's certain, places that you can get CBD that has helped. Again, that's really helped with relaxation and reducing the tinnitus. Again, promoting relaxation is one of the strategies that's really encouraged. Various apps like Calm, right? But there are specific apps out there that are specific for tinnitus. I listed a couple good ones here. The Resound Tinnitus Relief. There's also one from Starkey that's specific for tinnitus. Other things that the Odo Tinnitus Relief Therapy, that's an app as well. That's been just pretty new on the market. I have a patient actually trying that right now. Other things, sound generators, like a white noise machine, right? White noise machine, other sound generators, things that actually can, again, promote that relaxation and help reduce the tinnitus. Other things, again, hearing aids for sound therapy. Hearing aids for sound therapy are also an approach we certainly use a lot in the office. Again, so many folks have hearing loss with tinnitus. So again, we're using that sound, which we'll get into in a little bit, because there are, hearing aids. One particular, Widex, makes a fantastic device that has sound therapy embedded within the algorithm of the hearing aid that we use quite a bit. Okay. Yeah. Oh, thank you. So again, just a couple that we're going to touch on today. These are more behavioral approaches. There's one called the mindful-based tinnitus stress reduction. You can see the kind of theme here we're going. Again, classes are being offered by the ATA. Go on ata.org. There's a lot of podcasts, things like that. Biofeedback. The aim of biofeedback is to change behavioral traits, teaching patients to control their breathing, pulse, skin changes, and teaches patients how to cope with unwanted changes, whether their tinnitus gets a little bit louder. So you're presented with tinnitus, you hear the tinnitus, how to cope it without raising anxiety. Other types of therapy, acceptance, commitment therapy. Again, these are more, certainly this is a multidisciplinary type of approach. Not only you see us, but a psychologist would be certainly somebody that would work on these types of behavioral therapies. The acceptance, commitment therapy, acknowledging your tinnitus, accepting negative thoughts in patients. They have more of a greater control over their emotions. And this has actually been a pretty popular one. Cognitive behavioral therapy focuses on changing unhelpful cognitive distortions, your thought beliefs. The tinnitus is not going to hurt you, and trying to change your feelings about it. That has actually been quite popular and more of a newer approach. Again, multidisciplinary approach. There are support groups. One is local to Ewing, New Jersey. And again, I'm big on that ata.org. So take a look when you have a chance. And going to pass it over to Dr. Mariani. Right there. I don't see
All right,
you.
my video is a little slow. It'll come on. It's working on it.
Right. Very good. Here she is.
Yeah, my face will pop up in a minute, I promise, but I'll go ahead and start. There I am. There we go. So I'm going to talk a little bit about why is tinnitus so disturbing? What is it about this noise that gets people to come into our office or an ENT office or even their primary care physician? Why would just a noise in our ears bother us so much? And so I want to talk a little bit, there is a lot of neuroscience that goes into this, and I'm not going to go really far into that, but just kind of touch on it a little bit. One of the reasons why it's so disturbing is that any new sound that happens in our environment, whether it's in our body or just in our environment around us, gets our attention. This is important. This is for our survival. You hear something new, you pay attention to it. But the problem with tinnitus is that when we assign a negative emotion to a sound, then now it becomes an autonomic nervous system activation. So if you think about it this way, you're sitting in your living room, you hear a delivery truck squeal outside. Okay, you heard it, you paid attention to it, but it's just a delivery truck. You go about your day. But you're laying in bed at night and you hear a crash downstairs. Well, you heard it, you paid attention to it, and now your heart is racing because you assigned a negative emotion of fear to that sound. It got your nervous system really activated. With tinnitus, when we hear something in our head and we get anxious about it or upset about it, now our nervous system has assigned a negative emotion to that, and now it's going to really bother us, and we're not going to be able to just forget about it and let it go. So unfortunately, that we know science has proven that when we increase our stress, when our blood pressure gets going, that tinnitus can get ramped up, can make it even worse. So we start as a vicious cycle. And one of the reasons why we assign a negative emotion to the sound is because when we hear a sound in our head, it's worrisome. Anything that happens in our head can feel worrisome. Even if every doctor you've been to tells you it's not a sign of anything going on in your brain, it's still worrisome when something's happening inside your head. Also, unlike a noise that might be annoying in your environment, you can't walk away from it. It follows you. And it can sometimes, some people say it interferes with their ability to fall asleep. They're laying in bed, it's really quiet in their environment, and their ears are ringing and they can't relax enough to go to sleep. It can be very difficult to describe to other people, including your doctors and your other clinicians, which can then make it more anxious because you're not really getting the help you need because you're having difficulty describing exactly what you're hearing. And I think one of the biggest reasons why it's so disturbing is that other people can't hear it and they don't really understand what you're experiencing. So people around you who may be very well-meaning might say, well, it's just a noise, I don't hear it, just forget about it, ignore it. And they don't really understand what it's like to always have noise going on in your ears. They can't really understand it, and that also then it contributes to some of our anxieties. All right, so I think next up is Dr. James Martin. I remember I'm going to pass it over to him, and he's going to talk a little bit more about the brain than I did.
All right. Thank you, Dr. Kristen. And again, we want to thank you all for being a part of our meeting today. We're really excited to share this information. This is something I think that is very powerful for us as consumers and the general public, is to get an education about the things that we're maybe struggling with. And so I'm thankful for Cadence Hearing for offering this opportunity for you guys to come in and hear some updated information and maybe get some questions answered in the process. So my name is Dr. James Martin. I'm the Director of Education and Audiological Communications at Whiteaxe. I have been doing audiology for over 30 years now, but I've been with the company for about 25. That's my wonderful family there that helps me to stay focused on what I'm doing. My wife is a Dr. Martin as well. She focuses on cognition and working with children as well, and my 2 kids. So I love what we get to do, to talk about ears and hearing and just connect the dots, because there's a lot of information that is out there. And that's one thing that we are not missing out on, is information. You get on Google and all these other websites and look up a lot of information, but it doesn't necessarily mean it's correct for you, or that it's a clear indication of things that you may be struggling with. So it can be very confusing. So our hope today is to give you some guidelines, to put up some guardrails for you, to kind of direct you on the right path, and maybe answer some questions, of course, as we go forward. So it is my pleasure to kind of unpack a little bit more of the brain components and the autonomic system that we deal with when someone presents with what we consider head noise. Now, Dr. Wayne and Dr. Kristen all talked to you about some of the consequences, some of the challenges, a lot of the information that's out there that we deal with. But one thing that's interesting is that when we talk about ears and hearing, there's a lot of areas of the ear and the brain that we need to unpack. So my goal is to give you a very high level. Okay, this is not a deep dive by any stretch of the imagination. Unfortunately, we don't have the time just within our hour time together, but we want to give you just some general information about some things so that you have a little bit more clarity. Now, we understand that the ear provides our brain with sound information. There's a lot of processes that happen from the ear, outside ear, to the ear canal, to the bones in the ear, to the cochlea, which is a snail-shaped structure that houses our area of hearing. But where we hear and process sound happens in our brain, in our auditory cortex. That's where we process all these sounds and we perceive them. And once we get the sound into our head, there are a lot of areas that connect into the auditory system, like the limbic system. Dr. Kristen talked a little bit about the emotions that can be brought up when you're listening and how it can be worrisome to you. Well, you have a structure within the limbic system that houses two structures, the hippocampus and the amygdala. Those two structures help us do a couple things. One, the hippocampus is our memory storage. If you ever grew up like I did in West North Carolina, my mother kept a photo album on the center table that had all those pictures of when you were growing up and when you had your first piece of cake and when you got your first tooth, and those pictures of you sitting in the bathtub that they show at your wedding that you wish they were never there, right? Those are the pictures that we see. Think of the hippocampus as a memory storage area in your brain. It stores events that have happened in your life. Now, connected to that is the amygdala. The amygdala is part of the structure that deals with emotions or the fight or flight mechanism. These two structures work in tandem, right? Because sometimes if you experience something, if you see something and you experience an emotion, those two things get tied together. Technical term of that would be neural association. You know, if you experience something sad and there's a sad piece of music playing, your brain will lock those together so that when you hear that music, it will bring back the memory of that sound. Funny story. When I was in high school, I had a car. It was a yellow Vega. They don't make them anymore. It was very old, but it was mine, and I was thrilled to have this car. And so back then, most of the time, unlike today, I had a lot of hair. I had a pretty big afro that I had. And so I'm in high school. I'm in this yellow Vega that smoked. It barely ran, but it was mine. And I was thrilled to have this car. So driving down in high school, we were driving down, and I had the most expensive part of the car was the radio, of course, and I had it on. And this song came on called Dreamweaver. It was very popular back in the 60s and the 70s. And so I'm listening to that song. It's a beautiful day in the Blue Ridge Mountains, western North Carolina. I'm driving in this car with the windows down, and I remember that day. It was a fantastic day in my life, right? No bills, no worries. You're just driving down the road. So fast forward 30 some years, I'm now in a car. I'm driving in Florida. I'm working in an ENT office to see patients. And this song, Dreamweaver, comes on the radio. And immediately, I could tell you what the day was like. I could tell you how I felt. I could tell you the clothes I wore when I first heard that song. I could tell you the sneakers. I could tell you where I was on the part of the highway. Because when you connect an emotion to an event, it is a very, very powerful connection. Again, that neural association. And it's not just something that we experience in tragedy. It's something actually that real estate agents are using to sell homes. They've actually done studies where they've looked at how do we get people interested in homes? And they've done a test where they took a lot of people, let them walk through, 10 houses. And they came back at the end of the day and said, listen, we want you to tell us what you remember most about any of those houses. And after 10 houses, they're like, well, they all had carpet or hardwood. That was a nice kitchen, but they couldn't give you really any specific detail. Well, they changed the experiment the next time. They had people walk through 10 houses, but they did something different in one of the houses. They actually put the smell of baking cookies in the house. They had people walk through, and at the end of the day, guess which house most people could tell you more details about? Yep, you're right. The one with the smell of cookies, because the visuals and the smell, that neural association locks in information into our head. which is why when we talk about tinnitus and how we manage it, we not only have to help with the head sound, but manage the stress that can cause, because you get this, what we consider a tinnitus stress correlation. When you experience something stressful like tinnitus, your hearing in your head is nonstop, and it can have a lot of different, or present with a lot of different sounds. Some people hear a whoosh, some people hear a tonal quality, some people hear crickets. There's a lot of different qualifications that people have when they're listening and hearing tinnitus. But the louder you hear it in your head, the more it can stress you. And the more you are stressed, the louder that sound becomes. The louder that sound becomes, the more stress that it creates. So you get in this perpetual loop, this vicious cycle of hearing this head noise and the stress that it causes. So one of the things we know that we have to really hone in on when we deal with patients who have this tinnitus reaction is to bring their stress level down. So there's been a lot of research looking at what are the things that help people de-stress. And one of the most popular, actually, even USA Today did a study some years back, and they listed what are the things that people use to minimize stress. Now, I won't go through all of them, but there are a few, relax, taking a walk or breathing and those kind of things. But one of the things that is consistent on the list, very high, is music. Music is a form of media that actually engages our bodies in ways that no other form of media does. As a matter of fact, music is universal. A piece of music that we hear in the United States can be very popular in some other part of the world. So it's universal. It's something we all appreciate. Now, some of the elements of music may be different, the way the instruments are tuned and those kind of things, but music is universal. We all experience it. Even children experience music, where they dance and they move, and it can impact them emotionally when they're listening to different pieces of music. We all have a sensitivity to music, even without training. If you ever gone to a recital and the little kid was playing and they hit the wrong note when playing Mary Had a Little Lamb, we all know that note is not correct. Even if you don't play an instrument, even if you're not a professionally trained musician. So we all have this sensitivity to music. There's certain qualifications that we hear, and different cultures have different elements of music that are important to them, right? The way the instruments are tuned and so forth. And truly, as humans, which we all are, we live in an ocean of vibration, right? If you think about it, we're surrounded by all these molecules that when they hit each other and collide, that creates the sound wave that we perceive as sound. So you could have large waves of sound. If you've ever gone to a concert or gone out on a tarmac where there's a jet engine running, you could actually feel the energy in your body, right? That's a very large sound wave. And then there's those sound waves when people are whispering and talking very softly. That's a soft sound wave. So it's like we're surrounded by these sound waves, and they impact us very differently. There's been a lot of research looking at the implication of how we can use music and how music engages our brain. And because we can now see the brain at work using functional MRIs in ways that we never did, we have a deeper understanding of the areas of the brain that are impacted and how they create these emotions, these feelings that we have. No movie would be as successful without music. Scary movies use music to set us up, to get us tense, that something's going to happen. If it's a sad story in the movie, they will build music that adds elements that make it very emotional, right? So music is really organized sound. If you think of it like dropping a pebble in the middle of a pond, you get these very structured waves that come out from it. Versus taking your hand and just slapping the water goes everywhere. It's chaotic. So music is an organized sound. And music is so powerful that, again, neuroscientists and researchers have been looking at it. And Dr. Levinson is a researcher that I like a lot. He actually just had a new book called Successful Aging, and he talks about the cognitive impact of what happens when we get older and how to keep our brains really sharp and healthy. But in his research, he found that music, listening, performance, and composition engage nearly every area of the brain that we have so far identified and involve nearly every neural subsystem. So think about that for a minute. If we want to give the brain, the ears, something interesting to listen to that impacts the brain globally, then music is the best tool. Now, in the past, with some of these devices, what was used was a broadband noise. It sounded like shh. That was the sound they produced. And to your brain, that's not an interesting sound. And as I was saying before, music engages both the right and the left hemisphere of your brain in over 7 locations. There's nothing that engages the brain fully like that as far as media is concerned, other than music. And again, there are a lot of neurological bases for these different areas of the brain and the impact that the music has that we have seen. You know, if we're looking at music that's happy, that's usually major tones as we talk about it, there's different areas. The anterior cingulate cortex is an area. The amygdala is an area. We're looking at music that's more sad or has a more minor presentation. There are different areas that respond to that on different sides of the brain. So then music ends up being one of the most dynamic tools that we have now to engage the brain and keep the brain engaged and less focused on the head noise that we may be perceiving. The elements, the tempo of the music, the intensity of the music, the pitch of the music, all those elements engage the brain in different areas. So it is the best tool really to keep the brain engaged, right? So Widex decided many years ago, back in 2008, that based on all this research, we wanted to develop a tool that would really engage the brain, be pleasant to listen to, but help transition people who are having these head noise to a different place. Now, there are a lot of different tools. We actually developed a protocol that includes counseling, relaxation, musical components, and amplification, just taking all of it pulled together. It is the most comprehensive system out there. But we introduced it in 2008. It's in all product styles. So when we talk about styles, there are different types of devices, the ones that go behind the ear, the ones that go in the ear, the ones that go way down in the ear canal. There are different levels of technology. And we did not want anybody to miss out on the opportunity that this could provide if they were dealing with head noise. We've done many studies looking at the relaxation component of this tool. We looked at how it can be most engaging, what are the most dynamic musical patterns, and we wanted to create this passive listening environment. It's not something that we want you attending to. It will play softly in the background at a very low level. We usually set it at tempo that's at or near your resting heart rate, which is about 63 to 68 beats per minute. It needed to be something that was very smooth in movement. If it was very broken or staccato, that is an attention-grabbing musical element. So when you listen to music, if you hear the piccolo cutting through and it's doing something very staccato, right? That's very alerting, but it's wanting to get your attention to that piece of the music, right? We want it to be something that's very melodic, right? That's very settling. The tempo, again, has to be near your resting heart rate. And we do find that lower frequency sounds are more relaxing for us than higher frequency sounds. They're more alerting. But we couldn't just use the typical elements of music. We had to incorporate something called fractal tones. Now, fractal tones are music that doesn't play in a regular pattern. If you listen to a piece of music, for instance, your favorite artist, and you're listening to a track by your favorite artist, there's elements that are supposed to engage your emotion. If you are a good musician, your goal is to try to bring out the emotions in people, whether it's happy and you want to make them dance by the tempo and the beat and the pitch, or if it's something that you just want them to sit back and relax and just let the world go by and enjoy, then you will build your song with those elements of music that are most relaxing. The thing that we don't want to do here, though, is to recreate a melody that may be associated with an experience that you've had in life. For example, if I am outside and my pet hamster, right, gets run over by a tractor trailer while a song Amazing Grace comes on, right? Again, that neural association. Every time I hear Amazing Grace, I'm going to think about my pet hamster, right? So we want to break that cycle, right? We're not trying to engage the amygdala in the brain in that way. So these fractal tones use all the elements of music and the properties of music, but they're unpredicted. They play randomly so that you can associate a melody with the music that you're hearing through the device. The other thing that's real important about this device is that we do something called dichotic listening. Basically, what that means is that by having some of the sounds start in this ear, playing in that device, and they will move to the other ear through the device, we're actually engaging both hemispheres of the brain to create this dichotic listening environment. This device is the only device using for tinnitus management that engages and uses a dichotic listening system. So again, our goal is to really engage your brain to give you the elements you need to help transition you from focusing on the head sounds that you're having to focusing on the treatment plan that's being put together for you. And that's really important because everybody is different. Everybody is independent. They have their own preferences. So when you come in for an evaluation, you are treated so that we understand your journey and where you are. And not every piece of music has the same impact. So the device has 5 or 6 different soundscapes, sound profiles, so that we can pair that to you and what you like and what would be most relaxing for you. So again, this is a comprehensive program that is designed to help you navigate through some of the challenges that the head noise that you're experiencing may cause. Now, I have to say, just as I end my session, there's some warning against just using traditional music, and there are lots of studies. I wish I had the time to unpack all the different studies. Some of them are very interesting about how they impact our brain. But when you look at pre-recorded music, because I've had people go, well, if music is that powerful, why can't I just put it on and just listen to it and it helps? Well, remember we talked about the hippocampus and the amygdala and how we want to not engage the brain. We're not trying to engage that emotional memory of an event that may be paired with a song. So we don't want it to be something that you've heard or you could sing because that may bring up a memory, good or bad, that we're not trying to create. So we don't want to create that motion, nor do we want to create any unwanted distractions. We also want to make a difference between when you're enjoying a piece of music, you are actively listening to it. You are engaging on the instruments and maybe the details or the vocals that the singer is producing. We want to move to a passive. This is not designed to be at the very front. It's designed to be a very passive listening experience, right? And the fact that traditional music tends to arouse, right? We're not trying to arouse all these different emotions and things that are happening. We're trying to relax to get your body to transition so that we can give the brain the information to focus not on the head noise, but just to enjoy the music. It's a relaxation or habituation approach. So there are a lot of details here. I wish we could really unpack all of it for you, but Dr. Wayne, Dr. Kristen will spend as much time as they can with you. If you have further questions, if you come into the office for more information or detail to walk you through it. So, but right now I want to pass it back over to Dr. Kristen to unpack some of the information that we're going to next. So.
Thank you, James.
My
I think
pleasure.
we're, I think we're running a little slow. My Camera's a little slow again. All right, so I'm going to talk a little bit about, now that we've learned a little bit about tinnitus and we learned a little bit about, some of the processes involved, what happens next? What you've identified that you have tinnitus, now you want to do something about it. What comes along with a tinnitus appointment? And I promise my face will appear soon. I'm not sure why my camera's so slow, but I'll come up again. So when you make an appointment with us, it's going to be part of a bigger, hopefully what we hope is that appointment with us is just part of a bigger process of getting to the bottom of what's causing your tinnitus, and then hopefully find some management strategy. So I saw a couple questions coming in about people who have seen ENTs. ENTs are medical specialists. They are physicians. They are part of a big team of people that are there for you in your ears. They are a really good place to go when you're having, some tinnitus, when you're having something going on with your ears. They're one of the specialists we want to see. And Dr. Wayne talked a little bit about this too, especially with tinnitus, is that it really does require a multidisciplinary approach. So ENTs have their very important role in making sure our ears are healthy, making sure there isn't something medical going on that's causing it, maybe ruling some things out. And then we have our role of helping you identify if you have some hearing loss, talking about some of your management strategies, possibly being one of the people that helps you really take control of your tinnitus. And then there are many other professionals, like Dr. Wayne mentioned as well, that can also help manage your tinnitus. We talked a little about psychologists. Somebody I saw mention acupuncture. We've had a lot of patients have a lot of success with acupuncture. So there is a big team of people that we want to employ when we're talking about tinnitus management, and they're all really important. They all play their role. So in terms of what you to expect when you come see us, talk a little bit about what will happen at your appointment. Tinnitus appointments tend to be longer than an average hearing evaluation, and that's really important for several reasons, which I'll go over. So we want to make sure we take the time to do a really comprehensive case history. Dr. Wayne talked a lot about all the different things that can aggravate or even cause tinnitus, and we want to get to the bottom of making sure we're identifying all those possibilities so that we can help manage it the best we can. Okay, we also want to do a complete audiological evaluation. We want to make sure your ears are clear of wax. We want to make sure your eardrums are moving correctly and that you don't have any signs of fluid or anything. We want to see if you have hearing loss. If you do, what kind of hearing loss is it? How severe is it? In what frequency ranges is your hearing loss? This is all very valuable information in helping to manage your tinnitus if that's going to be the right option for you. We also want to make sure we see if we can measure your tinnitus. So it's not always possible to measure tinnitus, but for most people, we can get a fairly accurate picture of what it is sounding like to you, how loud it is, and also, can we mask it? Now, I'm going to talk a little bit about this word masking, which is really not a goal of tinnitus treatment, but when we're in our appointment, we just want to see, are we able to get a different sound to match your tinnitus so that we can maybe talk about whether or not sound therapy is going to be right for you. So those are separate from the hearing test, but it's part of the same appointment where we're really trying to identify more about your tinnitus. So I talked a little bit before about why it's bothersome. Other people can't hear it. When you come into the office, I can't put a headset up to your ears and hear your tinnitus, so I'm going to rely on you to try and help me figure out what it sounds like, and we'll do that through some tinnitus measurements. One thing that's really important in our practice, Dr. Wayne and I believe very strongly, is patient education, reviewing test results. This is a really important part of any appointment you come to with us, whether you have tinnitus or you're just having some trouble hearing. We really find it very important that you understand what tests we did, why did we do them, and what did we find, and making sure you really understand what's happening. If you have completely normal hearing, I want you to really understand that you have normal hearing. If you have hearing loss, then I really want you to understand what that means. What does it mean for you? Because one person's hearing loss can be very different than somebody else's hearing loss, and it can mean two very different experiences in your daily life. So that's really important for us at our practice. We spend a lot of time making sure you really understand your test results. And then, of course, if you are somebody who's suffering from tinnitus and, during our comprehensive case history, we've sort of identified how much it's impacting your daily life, then we will have to decide, if treatment is necessary, and if so, let's find a solution that's going to work well for you. And one really important part I always like to stress to people is that we're not, I wish I could say our goal for tinnitus is going to be to turn it off and you'll never hear it again. Really, although it happens for some people that their tinnitus can be completely resolved by identifying the problem, with most people, we're really working on trying to reduce the awareness of the tinnitus. And with that is the biggest piece, which is removing that negative response pattern. That's going to be our goals, our key to success there. All right, so a little bit about, okay, so you've come to see us, we've discovered you have tinnitus, we've talked a lot about it, so now what can we do about it? This is going to be very individualized, okay? So I can't tell you exactly what would happen for every person because this is really going to depend on all those things we just talked about. But just to give you a little bit of a structure of what would happen if we said, okay, you're a good candidate for somebody, we're going to try to manage this tinnitus, what are we going to do? And my first bullet point is probably the most important one. It takes time and motivation. Tinnitus has a big impact on our lives for most people, and it's not just going to go away right away. It does take some time and it does take some motivation, okay? Unfortunately, there is no magic pill to date. I know that science is working very, very hard. Researchers are trying to cure tinnitus, but at this point, there is no magic pill. It's similar to dizziness in the sense that there are lots of different things that can cause it. There are lots of things that can make it worse. So there's too many different possibilities. So right now, no magic pill. So I know that there are people who have seen doctors who have said you can take a vitamin or whatever, and your tinnitus will go away. It's really, there's no research that supports that. I always tell people that to be careful for anytime you see a magic pill online. The danger with that is that even if it's natural, doesn't mean it's safe, and to always talk to your primary care doctor before taking even a vitamin, because if you're on other medications, it can interfere. So just so you know, there is no magic tinnitus pill for everybody. Some people have found relief from different vitamins, but please be very careful. Talk to your doctor before you take anything. That's my spiel. All right. And Dr. May talked a lot about how all the other things that can impact or aggravate your tinnitus, and so she went through a lot of those. So as you can see on my bullet points, there are some things that can definitely impact and definitely aggravate your tinnitus. So it doesn't have to be one or the other. You can have tinnitus because you have hearing loss, but your stress or your anxiety is making it worse. It's not one or the other. You can have multiple reasons for your tinnitus, and they can certainly impact each other. Okay. The two biggest pieces of tinnitus treatment are going to be counseling, and that's really the structure of counseling is just to help you take control of that tinnitus. I tell all my patients, it sounds silly, but when you take control of your tinnitus, it can really help. I would tell people to talk to their tinnitus, tell them it's not bothering me. I'm not going to let you bother me. And that what you're really doing is you're helping your body reduce that stress, reduce that anxiety, which can also reduce that negative and emotional response to it. And sound therapy, Dr. James talked a bit about that, and that's the other piece of that really important structure. That sound therapy, if that's right for you, can really help your brain habituate to the sound, can really help it fade back into the background where we want it to be. Okay, and that's where I used the term masking earlier, and I sort of prefaced that by saying, that's a tricky word because we are not masking. We don't want to mask your tinnitus. We don't want to drown it out and cover it up. Instead, we really just want to help it kind of fade into the background and train your brain not to pay so much attention to it, and certainly not to be stressed about it or anxious about it. Those are our big goals. All right, I'm going to pass it over to Dr. Ali Tressiter, and she's going to talk a lot about her experience and give you good information.
Thanks, Dr. Mariani. So as she mentioned, I'm Dr. Tressiter. Dr. Mariani and Dr. Wayne know me as their WIDEX rep, but in a different life. I was active duty Army, and so I am a veteran, and I am a current Army reservist. So needless to say, I've got a lot of experience with people who have hearing loss and people who have tinnitus, and I am actually one of those people who have tinnitus. And so just to give you an idea, to let you know, really, if you have tinnitus, you are not alone. Tinnitus is actually the #1 disability for veterans. It is compensable. So sometimes it is so bad that they are actually compensated for how bad and how much it's affecting their lives. And then I find this number to be astounding. 1.6 million veterans receive disability benefits for tinnitus. 1.6 million. That is crazy. And in a way, I'll tell you a little bit about my experience with tinnitus, but in a way it makes me feel better or feel not alone, because when I first got tinnitus, it's very hard for me to kind of cope with, and I'm very type A. My husband knows everything in our house has its place. You know, I like to kind of have control over my situations, and tinnitus was one of those things that I really felt like I didn't have control, and that is what made it very difficult for me. And so I can actually tell you the exact situation of when my tinnitus started. So it was about 5 years ago. Someone fired a weapon right next to me. And so it was on my left side. The tinnitus is mostly in my left ear because of that, but I kind of get it. Sometimes it feels like it's in my head. I can't always say it's my left ear, but I do hear it. And it is, after it happened, I heard it right then and there. So my ear felt muffled. That's something called a temporary threshold shift. But you know, in addition to that, although that muffled feeling went away, the tinnitus never did. So, you know, luckily I am also an audiologist, and so I do kind of know about tinnitus. And so when it happened, I knew what was happening. That didn't make it any better for me at the moment. But I really had the benefit of my next duty station after that. I was stationed at Walter Reed. And so you guys may know about Walter Reed. It's an amazing military medical facility. You get to see all sorts of things when you're there. And so I was an audiology resident when I was there. And I saw pretty much everything you can imagine, and saw a lot of veterans who had tinnitus. And so at Walter Reed, they offered something very similar to what Dr. Wayne and Dr. Mariani are talking about, is this comprehensive look at tinnitus, right? We call it tinnitus retraining therapy. And so this was something that we offered our patients. And, you know, with me suffering from tinnitus, I was really interested to take part in that. And, you know, it was a really great experience, because while I was helping other people, as you know, we go through therapy, we do the total hearing evaluation, we find the cause of the tinnitus, all of these things. While we were helping the patients, it was also helping me. And like Dr. Mariani and Dr. Wayne mentioned, things like stress, alcohol, caffeine, blood thinners, loud sounds, things like that can all cause tinnitus or make it feel worse. And it can feel worse throughout the day. And so I don't know, you know, if anyone has experience in the military, but if you do, you know that us soldiers experience a lot of stress. Occasionally we'll have, you know, a glass of wine or two, caffeine. I am ashamed to say that I drank a lot of Red Bulls, you know, in my active duty time, and you know, blood thinners and loud sounds and things like that. So, you know, we've kind of got the whole gamut of things that can really make it worse. And so I was honestly a little bit skeptical to tinnitus retraining therapy, because I was like, okay, well, me talking about my tinnitus and me learning about it, it's not going to cure it. It's not going to make it go away. But I ate my words a little bit, because, you know, once I really wrapped my mind around, you know, what's happening, that I'm not alone, that I can take control over it, as silly as it sounds, that helped a lot. I will say I also wear hearing aids for tinnitus relief. I do not have hearing loss. And in fact, a lot of veterans who experience tinnitus do not have hearing loss. So you can have, you know, quote unquote, normal hearing and still have the perception of tinnitus. So I do not have a hearing loss, but I still wear my hearing aids to get some of that relief. And I actually do use the Zen program, which, you know, it's very different than some of the other ear level noises, like, you know, just a white noise or music. Zen really does kind of relax me. And so I use Zen. I started to do yoga. I put that off for a long time, but I'm starting to do yoga. Meditation, the Calm app has kind of changed my life. So I will say the biggest thing for me is knowing I wasn't alone was a big thing. You know, someone had mentioned that they've they've spoken with other people who have tinnitus, who have contemplated suicide because it was so bad. And that's something that I saw, you know, in the military. And a lot of times that's because it's kind of wrapped into this feeling of anxiety. There's usually depression, you know, things like that are all kind of balled together. So the tinnitus feels really bad. You know, people will do anything to make it stop. But when you really can take this whole approach, it's made a huge difference. And so please feel free to put any questions you have for me in the chat. As somebody who suffers from tinnitus, you know, I have it, I can hear it right now. So I'm happy to share. But, you know, other than that, I'll pass it back to Dr. Martin, Dr. Mariani, and Dr. Wayne, and we can start going over some of your questions that we saw in the chat. We saw some really great questions. Dr. Wayne, Dr. Martin, Dr. Mariani, you want to pop back on?
I'm on. Yes.
All right.
Yeah. Wow. That was fantastic. Allie, thank you very much for, you know, your testimonial there.
Happy to share.
Yeah, thank you so much. And I always say thank you for your service.
So thank you.
I appreciate it very much.
I loved what I did. So yeah, thank you.
You can tell. Absolutely. Very good. Yeah, thank you so much, everyone, for joining us. I hope you were able to pull some information that maybe you didn't have before that you can apply to your life right now to certainly improve your quality of life with your tinnitus. So definitely, I know we had a lot of questions. So Allie, did you want to field some of them and throw some our way, or?
Happy to, yeah. Let's start. I'm going to start right at the top. We had a question, I think, the first minute in, which is great. Somebody had asked, you know, if you've ever heard of a patient getting tinnitus immediately after having an endoscopy or colonoscopy, and I would assume that kind of applies to any sort of big procedure like that.
I have not, no. Although we are seeing, I mean, not here personally in the office. I mean, after the COVID vaccine, that's something that's a small percentage that I'm hearing of. But nothing like that. I don't know, Dr. Mariani. Have you? I have not.
I haven't personally haven't heard about that. I know that you are during those procedures, you're often given a lot of some different medication, and I know that there is a bit of a dehydration risk sometimes. So those are just thinking some of my just spitballing things that possibly I would think about, maybe either the medications given to you, or maybe if there's some dehydration, that would be my thinking, but I haven't personally heard of anything.
Yep, I would agree with that as well. Yeah, those medications can, you know, definitely have different effects on people.
Yeah, certainly. And there's over 200 of them, as I mentioned before, that can potentially cause tinnitus. So, yeah.
Okay, here's one we've kind of touched on it, but I think it's an important question to cover. Even though we talked a little bit about it, but are specialists working on a cure? I want to touch on that one more time, because that's the first question people ask typically, right? So I don't know if either of you want to field that one.
Say that one more time, because you kind of beeped out a little bit there. What was that again?
I'm still here. So are specialists working on a cure?
Cure. Oh yeah, there's certainly, that is the goal. I mean, I know they're working on sensorineural or neural hearing loss, you know, fixing that or trying to better that. I know for sure there's money going into tinnitus research. So yes, but I know unfortunately there's so many types of modalities that, you know, make tinnitus occur for someone. So it is a really tough, certainly tough thing to cure for sure, but no.
Great. Yeah, I do want to touch on that as well. Go ahead.
I wish that, yeah. I know there's money going into it, yeah.
Okay. Let's see. So here's another one. Can it be caused by a collapsed eustachian tube? If so, how long can it last?
Well, we talked a little bit about the changes in pressure within the middle ear. We, you know, talked a little bit about barotrauma in one of my slides. So absolutely. I mean, the eustachian tube basically regulates the pressure within that middle ear cavity. So if it's not opening well, then absolutely, certainly can. I mean, that's something that maybe an ENT probably could take a look for you. You know, I've heard of, you know, ENTs. I've heard of, you know, tubes being placed in the eardrum itself to help regulate that pressure. So absolutely, that's a yes.
Great. Okay. We've got a lot of questions that were very similar, and so I'm just trying to condense them a little bit. So here's a good question. Has anyone, and I can speak to this one if you guys don't have experience, but has anyone tried acupuncture for tinnitus relief?
Yeah, I have not, but again, I have had patients try it and absolutely think it's fantastic in regards to, their tinnitus patients. Again, it kind of goes with the whole relaxation type of mentality that we were certainly talking a lot about today. So I didn't really cover it in my slides, but yeah, absolutely. That's another one. Yeah, if it can promote type of relaxation, then yes.
That's great. Yeah, that's my experience as well. In the military, we actually do quite a bit of acupuncture. We also do quite a bit of dry needling. And for a lot of people, the cause of their tinnitus had to do with some other things going on, whether it be pain elsewhere in the body. A lot of people have neck and shoulder pain, right? And that can essentially cause tinnitus or make it feel worse. And so dry needling and acupuncture were ones that, it definitely did not help or cure everybody, but for some people, it did provide some relief. So that is a good question.
Good question.
Yeah. How about, this is a good one. How do you measure the pitch or the loudness of tinnitus?
Great question. Do you want me to take that one, or Kristen, do you want to take that
I
one?
can take that one. Yeah, I talked a little bit about what we'll be doing. So yeah, honestly, we talked a little about, you'll have to report to me. So basically we just play you a couple different tones and you're just telling us which one sounds more similar. We can't always find it exactly. It really just depends on what the noise inside your ear you're hearing. But we try and match it as close as we can, try and find something similar. So we have to kind of narrow it down. You find one that's closer, and same with the loudness. We kind of start soft when we get to a point where you tell us, is it about the same? So we kind of go through these and obviously give you much more detailed instructions when we're sitting, together. But that's how, by you reporting back to me whether the noise I'm playing you sounds like the noise that you're hearing.
Great. Okay. How about, this is an interesting one that will probably bring us back to the conversation of relaxation and looking at the whole picture. Can music help relieve stress in someone who has been deaf since birth? And I'm assuming that means a profound hearing loss or something similar.
Ooh, that's an interesting question.
Interesting question.
James, that was kind of your talk. Did you want to talk about that, or?
Sure. Well, what's interesting, I did work at the School for the Deaf for a little while, and those students still perceive the tempo of music. There's actually a great document on people who have hearing loss that still dance and move to the rhythm because they can still feel the tactile sensation that music produces.
Like a vibratory response, right?
Yep.
That's what I think,
and they actually treat some children like that who are deaf to learn to speak using a little vibrato device on their hands, and they do all the different exercises and they feel it as well. So yes, they can. That's a different thing than really treating the hearing loss, but perceiving the music, and that can be perceived easily by patients like that.
Good question.
That's cool. That's something I didn't know. That's cool. How about this one? Can tinnitus cause balance issues?
Well, I guess I'll field this one. I mean, the balance center, which is your vestibular center, is basically right next door to your ear. So, I mean, I guess it would be, what type of balance issues are you having? Are you having just, a swaying, or when you get up from somewhere, are you lightheaded? Or is it, benign positional proximal vertigo, which is a really common type of positional vertigo, meaning when you kind of tilt your head to the side, you're off balance, or you feel kind of swishy. So there's so many different types of vertigo. But I know, as somebody had asked this question in terms of BPPV, which is that benign positional proximal vertigo, which is a very common type of positional vertigo. And I think, Allie, you had mentioned 20% actually have tinnitus. So I think it kind of depends on the type of dizziness that you're kind of experiencing. And there's also Meniere's disease, which is also, if you know Huey Lewis in the News, I'm going back in time. Oh, that's a song I think that he sings, as a matter of fact. But he actually suffers from Meniere's disease, which is, that particular disease has roaring tinnitus associated with that, and incredible balance issues. I heard he's feeling better. Thank goodness. He's an incredible man. I had an opportunity to meet him many years ago, but has stopped him singing, things like that. So certainly, yes, but it depends on which type of balance issues you may be having.
That's great. Thank you very much. We've still got a few questions coming in. I know we're a little bit over. Are we okay continuing with a few more?
Yeah, I do have a patient in a little bit, but absolutely. Yeah.
Okay.
I think we are good for a couple minutes. Yeah. And thank you again for all these great questions, by the way, everybody. Holy
amazing
cow.
questions.
I know.
Amazing questions.
Wow. Yeah.
How about this one? Would olfactory hallucinations be associated with tinnitus, or are they even remotely related?
Olfactory, meaning obviously nose. I mean, they're in two different parts of the brain, being in the more of, I don't think it's not near the temporal portion of your ear, but I can't answer that. That's maybe a great question for an ear, nose, and throat physician, but nothing that I know of.
Yeah, that makes me wonder too. Dr. Martin was talking a lot about, memories and how certain things can provoke certain feelings. And so you almost wonder if a certain smell could do the exact same thing, right? Like there are certain smells that take me back to like 20 years ago, right? So I wonder if that could be related.
Another great question. Yeah.
This person said, am I weird that I don't mind the tinnitus? I actually sleep very well. It only bothers me when there is a loud pitch that comes and goes. So that's actually probably a good thing to talk about, maybe transient ear noise and the difference between that and tinnitus. And I can field that if you want.
Go ahead. Yeah, field that one. I was going to say, give you a shot.
So really by definition, tinnitus is going to be typically something you hear for long periods of time. So, if you wake up in the morning, you hear it, or you hear it for several hours at a time, it's bothersome. There's also this thing called transient ear noise, and pretty much everybody I know has experienced this, where you'll just be kind of sitting there, going about your day, and all of a sudden you hear this really loud, tone in your ear. Maybe your ear feels muffled for 10 or 15 seconds, and then it kind of dies away. That is very normal. Everybody experiences that, and it's only once it starts to last for these longer periods of time where it is significantly impacting your day. That's when we kind of start looking at a tinnitus diagnosis versus this transient ear noise piece. So,
but I'm glad whomever asked that question, I'm glad they're able to, maybe they've habituated to it as well. It's more or less accepted it. So yeah, exactly. Absolutely.
Yeah, I love that comment because it shows that, and I agree with it as someone who has tinnitus, that you can get to a point where it doesn't bother you. It's just part of your day, right?
Yeah, part of your existence. So maybe complete habituation on the person that answered that or asked that question.
I think that's a great point to hone in on as we kind of finish up, is that everybody is unique. Everybody is different. And so that's why it's really important to have the time to sit down and discuss your specific situation, the challenges that you're experiencing. Some person, that may experience tinnitus one or two times, it may impact them greatly. Whereas someone else may say, well, I hear it, but I don't pay attention to it, doesn't bother me, and they move on with their life. So I think it depends on the person as well. And that's why, most of what we discuss is really about understanding the journey and understanding the patient, and how do we step in to help transition them into, less annoyance from this and understand their journey. So.
Well said.
Yep. And then if we want to stop there, it looks like we've kind of touched on most questions in some way or another. It looks like I appreciate all of the questions, as I know Dr. Wayne and Dr. Martin and Dr. Mariani do. Maybe I'll do one more question that just came in. It's a pretty quick one. My tinnitus started after I started Invisalign, so braces. Will it go away once my Invisalign treatment is over?
Yeah, I wonder if it has anything to do with the temporomandibular joint, which is right next to that ear canal. I mean, certainly we touched a little bit upon that today. Yeah, I mean, again, a multidisciplinary approach. I have referred folks that have tinnitus to dentists that specifically work with TMJ. So maybe they had a previous TMJ diagnosis. I don't know. That's a great question, but I wonder if it's in any relation to the potential or past TMJ issue. So
Yeah, that's great. I mean, the head kind of all works together, right? And so a pain in my nose, a pain in my jaw, pain in my teeth. I had braces and I hated them. That pain can certainly cause tinnitus. So, um,
I know there were so many questions, and I think
There's
Dr.
so
Mary,
many
oh, there she is.
questions.
Hey. Oh, it's a family
Sorry.
affair here at Cadence
Yeah,
Hearing.
sorry, we have a little guest here for.
That's quite okay.
Yeah.
Oh, hey, Michael. Well, hi.
All right.
Oh, gosh, she's so cute.
So thank you, everybody. I'll pass
Yeah.
it back to Dr. Martin.
Yeah, thank you guys so much. We appreciate you taking the time to be with us. I know some of you had to leave. We don't take it lightly that you took the time to spend with us today. There are ways of contacting the office. Cadencehearing.com is a good way to reach out and further ask questions, schedule an appointment, come in and just have a general discussion, get your hearing tested, which is always important.
Very
for
important.
everyone,
First
regardless
thing.
if you have tinnitus or not.
Absolutely.
Yeah, get your hearing tested yearly. But thank you for taking the time. We're so pleased to serve you today. And if you have any questions, please reach out to us. But thank you so much for joining us.
Thank you so much. We hope we get to see some of you in the office. Thank you so much, everybody.
Yeah,
for joining
thank
us.
you, everybody. Thank you.
Bye-bye.
Take care. Bye.
Oh.